Can you play sports if you have kidney disease? In this episode, we'll explore the benefits and potential risk of physical activity for those who have kidney disease, how to safely engage in sports, and expert tips for maintaining an active lifestyle despite the kidney challenges. Welcome back to the Kidney Zone. I'm Dr. Mo. Before we begin, please remember this video is for informational purpose only. If you have any concerns about your kidney or your health, it's important to consult with a healthcare professional. Let's start by understanding kidney disease. What is kidney disease? Kidney disease encompasses conditions that impair the kidney ability to function properly. This includes chronic kidney disease, which is progressive and can lead to end-stage renal disease. Physical activity is crucial for overall health and well-being. It helps to control the blood pressure, manage weight, improve cardiovascular health, and enhances the mental health, all of which are beneficial for individuals with kidney disease. So what are the benefits of exercise for kidney disease patients? Regular exercise strengthens the heart and improves the blood circulation, reducing the risk for heart disease, which is a common complication for kidney disease patients. Also helps with blood pressure management because exercise helps lower the blood pressure, which is a leading cause and consequence of kidney disease as well. Controlled blood pressure slows the progression of kidney damage. It's also important for weight management. Maintaining a healthy weight through physical activity reduces the strain on the kidneys and helps manage associated conditions like diabetes and high blood pressure. Physical activity is also important for enhanced mental health because it releases endorphins which improve the mood and reduce stress and anxiety. This mental health boost is essential for those managing a chronic illness such as chronic kidney disease. How to safely engage in sports with kidney disease? First off, consult with your healthcare provider before starting any exercise routine. Consult with your nephrologist or your primary care provider is very important. They can provide personalized advice based on the overall conditions and of your overall health. Start slow and gradual. Begin with low-impact exercise like walking, swimming, or cycling. Gradually increase intensity and duration. Your fitness level improves as recommended by your healthcare provider, and you should do this gradually. It's very important to stay hydrated. Proper hydration is crucial, but not only for kidney disease, but for all fluid balance. It's very important to take fluid carefully and follow your healthcare provider on guidelines of fluid intake, especially during and after exercise. Always monitor your symptoms. Pay attention on how your body responds to physical activity. If you experience unusual symptoms like dizziness, shortness of breath, chest pain, or severe fatigue, stop exercise and seek medical advice immediately. Avoid high-risk activities. Contact sports or activities with a high risk of injury should be avoided, as kidney disease can make recovery from injuries more complicated. Choose sports that are safe and also enjoyable for you. So, what are the recommended exercises for kidney disease patients? Walking. Walking is a low-impact exercise that is easily incorporated into your daily life. It helps improve the cardiovascular health and can be done almost anywhere. Another activity is swimming. Swimming is very excellent for joint health and provides full body workout. It's especially beneficial for those with mobility issues. Cycling. Whether on a stationary bike or outdoors, it's a great way to boost cardiovascular fitness without putting too much strain in your body. Yoga and stretching exercises improve flexibility, reduce stress, and promote overall well-being. They can be adapted to suit different fitness levels. Let's talk about strength training. Light strength training with weights or resistance bands helps build muscle mass and strength. It's important to start with a light weight and gradually increase as tolerated. Now, the most important question that many people ask: can you be a bodybuilder with kidney disease? Well, while bodybuilding is possible for those with kidney disease, it requires careful planning and medical supervision. The intense physical exertion and dietary requirements of bodybuilding can place additional stress on the kidneys. Consultation and monitoring are very important. Close collaboration with healthcare providers, including nephrologists and dietitians, is very important. They can help to tailor a bodybuilding program that considers body function and kidney function and overall health and well-being. There is also modified training. Emphasis should be put on moderate strength training with appropriate rest period to avoid overexertion. Nutrition plans must balance protein intake to support muscle growth while protecting the kidney health at the same time. There is some special consideration for dialysis patients. Timing of exercise, dialysis patients should coordinate with their treatment schedule. Light exercise on non-dialysis days or after dialysis session is often recommended. Managing fatigue is another issue. Fatigue is common among dialysis patients. Choose exercise times when you feel most energetic and listen to your body's signals. How about patients on peritoneal dialysis? Patients on peritoneal dialysis should avoid exercise that put pressure on the abdominal area. Walking, swimming, and light cycling are good options for exercise. Playing sports and engaging in physical activity is not only possible for individuals with kidney disease, but it's highly recommended and highly beneficial. Let's start by understanding the kidney function in athletes. The role of kidney function in the body and the kidneys are responsible for filtering waste products and excess fluids from the blood, maintaining electrolyte balance, and regulating blood pressure and other activities. For athletes, the kidneys also play a crucial role in managing hydration levels, which are essential for optimal performance. Kidney stress during endurance activities increases the metabolic waste. The intense and prolonged physical activity leads to the production of more metabolic waste, which the kidneys must filter out. This increased workload can strain the kidneys, especially during long endurance events. So what's the dehydration risk? Endurance athletes are at higher risk of dehydration, which can reduce the kidney function temporarily. Dehydration can also lead to increased concentration of waste in the blood, making the kidneys work harder. What are the potential kidney risks for endurance athletes? Exercise-induced acute kidney injury is one of the major risks. So what is exercise-induced acute kidney injury? During extreme physical exertion, some athletes may experience a condition known as exercise-induced acute kidney injury. This occurs when the kidneys temporarily lose some of their ability to filter waste products, leading to a buildup of toxins in the blood. What are the causes? Can be dehydration, heat stress, and high-intensity exercise can contribute to that acute kidney injury. Rhabdomyolysis, which is also a condition where the muscle tissue breaks down rapidly, releasing a substance called myoglobin into the bloodstream, can also lead to kidney damage. Also, electrolyte imbalance is one of the problems of endurance activity. What's the importance of electrolytes? Sodium, potassium, and other electrolytes are critical for nerve function, muscle contraction, and overall body functions. Endurance athletes lose significant amount of electrolytes through sweating, which can lead to imbalance that affect the kidney function. So what's the impact of electrolyte imbalance on the kidney? The electrolyte imbalance can strain the kidneys as they work to maintain proper blood composition and balance the fluids. Over time, the strain can lead to kidney issues if not managed properly. So protecting your kidney health as an endurance athlete is very important. Let's focus on hydration strategies. Stay hydrated. Proper hydration is key to maintaining kidney health during endurance activities. Athletes should also always aim to stay hydrated before, during, and after exercise. Monitor the urine color as a simple way to gauge hydration levels. It's also very important to balance fluid intake. While hydration is very important, it's important not to overhydrate, as this can lead to hyponatremia or low sodium level, a condition where the blood sodium level can become dangerously low. This can cause athletes to have other problems. Athletes should drink according to thirst and adjust fluid intake based on the intensity and the duration of exercise. Now let's talk about electrolyte management. Use sports drinks wisely. Sport drinks containing electrolytes can help replenish lost sodium and potassium during prolonged exercise. However, they should be used appropriately, as too much of these electrolytes can also lead to imbalance. Let's also discuss balanced diet. A diet rich in fruits, vegetables, and whole foods will naturally supply the body with necessary electrolytes. It's very important to consult with a sports nutritional specialist that can help the athletes tailor their diet to their specific needs. Now let's talk about recovery and monitoring after exercise. Allowing sufficient recovery time between intense workout is very important for kidney health. During recovery, the kidneys can repair and return the normal function after the stress of exercise. It's very important also to do regular health checkups. Athletes should always do regular checkups that include kidney function tests, especially if they engage in high intensity or long duration sports. Early detection of any issue can prevent long-term damage. There are some special considerations for endurance athletes that we should focus on. There is rhabdomyolysis. Awareness and understanding the risk is very important. Athletes should be aware of the symptoms of rhabdomyolysis, such as muscle pain, weakness, and dark urine, which indicate the presence of myoglobin in the urine. So whenever you see this, immediate medical attention is very important if you see any of these symptoms, because untreated rhabdomyolysis can lead to kidney failure. Also, treating in heat. Heat is one of the significant events that endurance athletes can face. Heat and kidney stress are related. Training in hot and humid environments can increase the risk of dehydration and kidney strain. Athletes should take precautions such as training during cooler times of the day, using cooling techniques, and staying well hydrated. How about supplements and kidney health? Many endurance athletes use substances that can be unregulated, such as supplements. So use caution with supplements. Some supplements, particularly those high in protein or certain herbal products, can be taxing on the kidneys. Athletes should consult with a healthcare provider before starting any new supplement regimen to ensure the safety of their kidneys. So in conclusion, kidney health is critical yet often overlooked. Aspects of endurance sports should be considered during the kidney function. While pushing physical limits is part of the journey for many athletes, it's important to do so an awareness of the potential risk to the kidney health. By staying hydrated, managing electrolyte levels, and being mindful of recovery, endurance athletes can protect their kidneys while continuing to pursue their athletic goals. Remember, taking care of your kidneys is not just about the performance today, but also it's about ensuring your health for the future. If you found this episode helpful, please remember to share and subscribe to us on your favorite podcast platform. And stay hydrated, stay active, push those limits, and wait for our next episode of The Kidney Zone.